Good afternoon. This is Yogarani, Chief Physiotherapist from ChanRe Rheumatology and Immunology Research Center. Today I am going to talk about the PCOS, how the exercise is helpful to come out from those diseases. Now we'll see what is PCOS. Let me see what is PCOS. It is a polycystic ovarian syndrome. From the ovaries, it releases the abnormal male hormone. It's usually it present in the women, but in this condition, abnormally the amount will increase. So for that, polycystic ovarian syndrome will happen. This is nothing but small cyst, the number of small cysts form in the ovaries. Why it's happening? Because of the obesity. Now we'll see what is obesity. Overweight and obesity is defined as abnormally or excessive fat accumulation in our body. How we can tell I am obese, I am normal, I am underweight. There are some of the indicators we use to measure those kind of the categories. One is growth chart, skin fold thickness, BMI. In the growth chart, we can height and weight can be compared and plotted the categories. Then in skin fold thickness, we have the caliper. In the help of the caliper, we used to pick the skin. It is more in obese patient. BMI, it's the body mass index. In this one, height and weight and age and gender also is specific in it. In the three indicators, BMI is the best one to categorize the body weight, whether it is obese or overweight, underweight, because in that one we are specific the age and gender also. Now we'll see how we can calculate the body mass index. As is seen in the picture, the body mass index weight by height. So you can see in the picture there are the categories. One is underweight, normal, overweight, obese, or extremely obese. These are the range. According to this range, we used to tell the person 18.5, it is underweight. 18.5 to 24.9 is the normal. 24 to 29 is overweight. 30 to 35.9 is obese. Is 35 or above 35 is extremely obese. You can see that one, there are the 73% of Indians are overweight. So we can take it out of 4, 3 are obese only. So the major risk of the age is 28 to 38 years. So in this age group, weight gain happen more. So these age groups, for people have to concentrate their diet and as well as exercise protocol. How the obesity is happening? What is the cause of the obesity? Energy intake and energy expenditure. Is nothing but how much calorie you are taking in, then how much calorie you are spending outside. This when the balance is go for imbalance, that time only the obesity will happen. Okay, we'll see what is imbalance now. Energy balance can be compared in a scale, and when the energy imbalance is happening, The number of calories of consumed is not equal to number of calories you are expending. So you are taking the so much calorie, but not expending that much. That time only the obesity will happen. Now we'll see how these are the bad habits. So if I was worked for the whole day, I wanted to take a rest. Yeah, you just take a rest. But on the time also, what we are doing, we are eating the sweets, some junk foods, or unhealthy things. These are the causes for main for the obesity. So we can take a rest, but avoid the sweets, junk food, and unhealthy drinks. Okay, I am obese. What is the problem? Yeah, it's really because unknowingly our affecting our own body. There are the some impacts of I mentioned here in this picture. Type 2 diabetes, hyperlipidemia, obstructive sleep apnea, heart disease, hypertension, osteoarthritis. These are the some examples of impacts of obesity on health. How we can prevent the obesity? Avoid the stress. Nowadays, the stress is more. So avoid the stress. Eat healthy food. Can't able to stop the fast food, at least limit the consuming that fast food. Reject the bad habits, do the exercises, do the physical activities more, avoid the stillness, don't sit for a long time. Just plan your day accordingly, just plan the physical activity also. So now we'll see what is the physical activity and the exercise. All have the confusion about that physical activity and exercise because every woman they will tell I'm doing lot of work in my home that also I can't able to reduce my weight. Why? Because this will give the explanation to you. First, what is physical activity? Physical activity, it is our we will move the body to do the work, either the some work in home activities. So otherwise, while walking for some other purpose. So these are the simple activities we call the physical activity. In this one, we can't spend much more calorie because it is very limited calorie only we can spend. These are the physical activities. When we come to the exercise, it is a planned, structured, and repeated activities. In this one, we can plan it before only. How much I have to spend, how much I have to spend the calorie, how much repetition I have to do, which time I have to do, everything will be planned before only. So really we wanted to reduce the weight, we have to do the exercises regularly. So now we'll see exercises. Only the exercise can promote the weight loss. It will, but along with the low calorie foods, that weight loss will happen soon. So exercise plus the diet, it leads very easily to reduce the weight. So some people, I can't able to cut down the calories. Okay, fair enough, fine. You do the high intensity exercises and the long duration of period. So those protocols you have to follow to reduce the weight. At least 45 minutes to 1 hour, you have to do the exercises like aerobic, some other the strength and training exercises. You have to do for at least 5 days a week. So why warm up and cool down is very needed? Because as a beginner, they started eagerly. I wanted to reduce the weight, so I started the walking. So they are not concentrating the warm up and cool down at all. All of a sudden, they started the walking. So what happened? The muscle will go for the soreness. So after that, they lose the hope. So when I started the walking, I'm getting the pain. So I don't wanted to do the exercises. These are the negative things thinking will happen to the people. For that, we have before starting the exercise program, you have to meet your one physiotherapist. They will give the clear prescription of the exercise, everything. So warm up and cool down is very, very essential before starting the either the aerobic or the anaerobic exercises. Because any exercise before introducing to our body, we have to ready the body first. For that, we are doing the warm-up exercise. Then why have to do the cool-down exercise in the sense? After our exercise program, our heart rate will go for higher level comparatively to our normal heart rate level. So for that, we have to get down the heart rate to the normal level. For that, we have to do the cool down exercises along with the stretching exercises also very needed to prevent the injury or soreness. So there are the two type of exercise are there. One is the aerobic exercise, one more is anaerobic exercise. In aerobic exercise, we can do the long duration, low intensity exercises like walking, running, cycling. These are the examples of aerobic exercises. In the aerobic exercise, the cardio fitness, we can maintain it. Then in this one, that oxygen burn the carbohydrate and fat also. Now we come to the anaerobic exercises. It is the high intensity, short duration exercises. It is nothing but our weight training exercise we'll call the anaerobic exercises. In this one, only we'll take the carbohydrate to produce the energy. How I can go for the aerobic exercise progressions? You can, these are, as you seen in the picture, these are the examples of the aerobic exercises: walking, running, cycling, stair climbing. These are the things, are some examples for the aerobic exercises. How I can do the progression in that one? You can increase the speed, increase the duration, increase the resistance. According these ways, you can able to increase the progression of the aerobic exercises. Some example, now I'll show you the some of the aerobic exercises example. In that aerobic exercises, some of low impact and higher impact exercise. In low impact exercise are the swimming, cycling, walking, and rowing. These are the exercise will give the lesser stress to your joint. These we called the lower impact exercises. Some patients, the older age, otherwise those who have some diseases like arthritis, those people can't able to do the high impact exercises. Those people can concentrate the lower impact exercises. Then the next one is the higher impact exercises: running, jumping rope. Those are the examples of higher impact exercises. So how I get start the anaerobic exercise? Before starting the anaerobic exercise, if you are a sedentary lifestyle, you start slowly and gradually increase the intensity. All of a sudden, if you are rushing the joint to do all the activities, the muscle, otherwise joints go for injury. So before that, you just slow and gradually gradually increase the intensity program. Before starting the program, you just consult your physical therapist to correct the correct perform. Then what kind of the exercise is suitable for your body? Accordingly, you can manage it. So when you are doing the anaerobic exercises, you have to think out at least the group of, you have to plan according to the group of muscles. So like upper limb, abdomen, then lower limb. Because when you are, today you are giving the exercise program to your upper limb muscles. So don't give those exercise for the next day. You just give the gap for the upper limb and go with the lower limb exercise. It can avoid the injury and soreness of the muscles also. As we discussed earlier only, anaerobic exercise is nothing but the strength training exercises with the dumbbells. Some weights will use to do to strengthen the muscles. So the muscle will go for soreness. For that, we are giving to those muscles take a breath, then get ready for the next workout. So you just please plan the group of muscle exercise: upper limb, abdomen, then the lower limb. Accordingly, you plan and do the anaerobic exercises. So always make sure if any disease, otherwise you are the old age, make sure before you just consult your doctor and healthcare providers to your capacity. Otherwise, anything red flag like osteoporosis, anything deformities is there. Accordingly, we will give the exercise protocol. So those kind of the people can meet the health provider to take a proper exercise protocol. So now we'll see the some examples of anaerobic exercise. So as I told you before, weightlifting exercise with the dumbbells, that the rod, TheraBand, those exercise will come under the weightlifting. The high intensity interval training is the, we giving the short interval time, will give the higher intensity program. So plyometrics, it is nothing but our own body weight. We can do as like a weight. Then we'll plan the exercises like squatting, rope jumping. Those exercises will come under the plyometrics. Okay, how much exercise I have to do? How much exercise if I'll do? Really, I'll reduce the weight. Minimum 20 minutes of exercise is needed per day. If really you wanted to lose the weight in 45 minutes to 1 hour, this exercise is very, very needed for you. You have to do the warm up, cool down, strengthening, aerobic. These kind of the combined program have to maintain at least per week 5 days. These will help to reduce the weight. So my conclusion: carrying around too much of weight, no, unknowingly we are damaging our health. So burn your fat before it harms your health. So eat right and fight with the fat. So uh, take a proper diet opinion and take a proper correct exercise protocol. Do the exercise regularly. Be active. You can stay away from some of the so many kind of diseases like diabetes, osteoarthritis, PCOS. This and all we can avoid it. So do the exercise regularly. Stay healthy. Thank you.